So this is an older leg model, but it helps us see some of the things we were just referring to. So here's the anterior tibial running down between the two bones and then coming over the top of the foot. So this would be the dorsipedis as it comes over the top of the foot. This is that large medial vein that starts in the foot, runs up the medial aspect of the leg, and then would connect to right here. So that would be the great saphenous vein that would be seen there. Deep in the thigh here, we can see the femoral artery and femoral vein running next to each other. Now, as we get up into the groin, this is referred to as an inguinal ligament. And as soon as this blood vessel passes underneath the inguinal ligament, then it's renamed. So it becomes the femoral right here. And above the inguinal ligament in here, it is part of that system of iliacs. So from a clinical standpoint, we do a femoral pulse right here in the groin area because this is the femoral artery. So if we look internally up here, we can see the external iliac artery and vein. We can see, if we turn it around, the branch that goes deep in the pelvis, so the internal iliac artery and vein. And we can see where the two branches come together, which would be our common iliac artery and vein that we see at the top.
Okay.
So as we're looking at the arm, then we can see the pattern we're talking about. Here's the clavicle. So the arteries and veins we see that are going under the clavicle here are the subclavians. We can see where they enter the armpit region here, which would be the axillary. And then continue down the arm as the brachial artery. In the elbow area, they branch. And one branch goes over here and runs down to here along the ulna, which would be the ulnar artery. The other branch runs along the radius that we're seeing here, which is the radial artery and vein. And just as a side note, the ulnar artery is deeper. That's why clinically we use a radial pulse when we check for pulses here, is because the radial artery is closer to the surface compared to the ulnar artery, which we can see on the other side. So looking at the venual system back, remember that we have a superficial vein that we can see running up the inner part of the arm that we're seeing right here, which would be the basilic. And then we have a very superficial vein that runs on the lateral aspect of the arm that we can see part of right here, which would be the cephalic vein. Now let's take a close look at the supply of blood for the abdomen that we were referring to on the other model using this torso. So this represents the central tendon of our diaphragm. So the part of the aorta we see here would be the thoracic aorta. We can see the aortic arch here with the brachiocephalic as the first branch, the left common carotid, which would be going up the neck here, and then the subclavian that we can see running along with this vein that we're seeing here. So this would be the cephalic vein that we were just referring to. That is the lateralmost on the arm crossing the deltoid here. And then this would be the internal jugular that we're seeing here. And as I said, the common carotid that we're seeing here. Now remember, when we're looking at lungs, the blue ones are the arteries, so this would be a pulmonary artery. And then the red ones are veins, so this would be a pulmonary vein. Now, as we enter the abdomen, just below the diaphragm, there's a branch. The first branch right off of the aorta is the celiac trunk we're seeing here. And the celiac trunk is definable because there are three main branches that come right off of it quickly. The splenic, which would be going over here to the spleen, the hepatic, which would be going over here to the liver, and the upper branch here, the gastric, which would be coming up here to the stomach. So this small blood vessel that before it branches is called the celiac trunk, and then the three branches off of it: splenic, hepatic, gastric. Once we find the celiac trunk, the next branch above the renal arteries and veins is the superior mesenteric. As we go downward below the renal arteries and veins, we would have a branch coming off the anterior aspect of the aorta, which is the inferior mesenteric. At about the same level where the inferior mesenteric comes off, we can see an artery that courses down through the pelvis. And in this instance, it's going down here to the testes. So this would be the testicular artery on both sides. That would be passing out and going down to the testis. Now, as we continue downward, the aorta is going to branch. So the branch here is called the common iliacs. As we see that it branches here, and a branch goes deep into the pelvic region, so the internal iliac, and then a branch that continues on toward the inguinal ligament here, which is the external iliac. And then as soon as that passes through the body wall here, we would have a femoral artery and vein. Now the other thing that you can see on the model that is a large vein in the medial aspect of the thigh, very superficial, underlying the skin. And this would be the great saphenous vein that we're referring to, coming back to where it enters the femoral vein here. And then as we're looking at that blood flow pattern, then external iliac vein, internal iliac vein, common iliac vein. And the two common iliac veins give rise to the inferior vena cava that we're seeing